Okay, so this video today is going to provide you with some common questions about Medicare, the new Medicare telehealth, the expansion that's going on there. So CMS is actually expanding the benefit for on a temporary basis, an emergency basis for telehealth. It's actually part of the CARES program, Coronavirus Preparedness Response Supplemental Act, Appropriations Act. So very complicated, but it's also really good news. So this is mostly for people with Medicare. Without getting into all the actual rules and things, the technology CMS has come out and definitely announcing to help doctors primarily, I would say, figure out how to charge and how to bill for this. But these services are definitely for people who are currently on Medicare. They're designed to pay for care at home and nursing care, assisted living facilities, as far as the telehealth services. So if you're in a nursing home or facility, or at home, you can communicate directly with your caregiver, certain caregivers, let's say primarily your doctors and folks at the doctor's office about what you may be. So let's talk about what telehealth services are. There's a lot of things that you'll see today. You can read all the articles, but basically it's any kind of audio or video communications that you would have with your doctor's office or your caregivers. And it's just that simple. You get into all the telecommunications and the rules regarding that. Those are primarily for your physicians, your clinician, who's going to help with that. So again, it's just really any type of device. Probably may already be using that to talk to your grandchildren, using Skype or using FaceTime, that sort of thing. Or Zoom is a big deal today. All the kids are going to school and talking to their teachers using various ways to do that. So there's certain people that can talk to you, so physician assistants, doctors, social workers, psychologists, nutrition specialists, just all kinds of people that you can, but there are definitely rules as to who you can talk to. But you're at home and you want to stay at home, mainly to protect yourself or also to protect the other folks who may be going to the doctor's office. So what can Medicare pay for? Well, they can pay for an office visit, other visits furnished via telehealth across the country, and including patients where they're residents. So, a lot of this has already been going on in the rural areas of the country, but now it's available to everybody in the urban markets to you. So the key idea here is to help you remain isolated or to prevent the spread of the virus. Or if you're already infected, that can get you care without the risk of exposure to others, which makes perfect sense. So really happy to see, personally, I'm really glad to see the government, Medicare's come in and quickly expanded these services for telehealth questions. So you'll be able to receive specific sets of instructions via the counseling. There's Medicare mental health counseling and preventive health screenings, all kinds of things that are going on. Before, and then now they're allowing for really 80 additional services that you may or may not want to read about, but you could go out to Medicare.gov potentially, or go to Google and look that up. But there's a lot of stuff there. Your home visits, your therapy services, which all are provided, can pretty much be done via video or audio transmissions there. So it's all good stuff. If you have any other questions about this, or comments, just go ahead and click the comments down below, or give us a like if you'd like to, and we'll continue on. This is part of a series of question and answers that we get. We get tons of questions about this sort of thing every day, and it's complex, there's no question about that. But we're able to maybe get down and get to the real basics for you. Hopefully this helps. If it does, we'd appreciate the comments, likes, and come call us. You can call us on our phone. You'll see the phone numbers down below. I want to wish everybody safety and stay safe, and we'll see you on the next video.